We've been bringing you the best of some of the 1,000+ posters that have been put up here at EASD, and I'm very pleased to welcome Stig Molsted. I hope I said that right. Stig is from Denmark, and he's a physiotherapist.
Yes.
And I think we're seeing increasingly, reflecting the fact that diabetes has so many comorbidities, a wide range of other professions coming along to EASD. Tell me about your poster, which is about rheumatoid arthritis.
About my study? Yes, for a period we have been interested in barriers to physical activity among patients with diabetes, especially those with type 2 diabetes. And we know that pain from the musculoskeletal system is a pronounced barrier. And we also know that people with diabetes report pain from this musculoskeletal system more often than people without diabetes. So we were wondering what were the role of some of 3 rheumatoid diseases in relation to diabetes. And we got data from the Danish Health and Mobility Survey, which is a ongoing survey conducted every 5 years in Denmark. And we stratified them into those with diabetes and those who reported not to have diabetes. And we saw that what we have shown before, that there was an elevated odds ratio to have pain from the musculoskeletal system if you had diabetes. And we also saw that it was a very interesting increased odds ratio to have osteoporosis, osteoarthritis, and rheumatoid arthritis if you had diabetes. We do not know exactly the reason and what comes first, but it may be an association that if you have arthritis, you may have so many pains from the musculoskeletal system that you do not perform enough physical activity to prevent the development of type 2 diabetes. But there may also be other reasons that an association between if you have an osteoarthritis, for example, you have a low-grade inflammation, which may also be associated with the development of type 2 diabetes.
So what does this mean for the practicing physiotherapist as well as the practicing clinician specializing in diabetes?
Yeah. That's a very good question. That's actually the most important thing about this. Having these 3 kinds of rheumatoid diseases is not a contraindication to be physically active. So the very important message to the clinical practitioners and the other staff that the patients meet, and include the patients as well. It's very important to inform about it's not a contraindication to be physical active if you have this. Actually, you have 2 good reasons to be physical active if you have diabetes and one of these diseases.
So you'll be okay, you won't come to any harm if you do exercise, but you might want to up your pain control in order to do that.
Exactly.
Fantastic, very nice piece of work. Thank you so much for coming here.
Thank you.
And of course, as always, you can see that poster on easd.org.